So part of the SMART protocol, so let's go back to like why. I'm always about like, why am I doing this? I don't just like willy-nilly like to practice anything. So when it comes to amalgam, so this is something that they teach in dental schools. This is cold hard facts, is that the most dangerous part of amalgam fillings is the removal, so the vapor that's created when we're removing them. So during the SMART protocol of removing a mercury filling, we're barriering off your tooth and your tissues, so none of that amalgam is getting onto your tissues, which can be absorbed into it. So we're creating a barrier there. And then we are having you breathe oxygen. So we're actually putting a nasal cannula over your face. We're covering any exposed skin that you may have. So you're breathing 100% oxygen the entire time that we're removing that. And then we're using a high volume suction on the assistant side and then an external suction in front of you. My office also has certain scavengers in the ceilings of each of our operatories that actually filter the air of any kind of particles. And then sometimes, depending, we actually have like the door or window open in the office during that amalgam, depending on how many we're doing or how big that may be. And that can be if we're taking off an old PFM and we're not sure what's underneath it. That's a huge part of it, is like you have these crowns that have been on there for 15, 20 years, and more often than not, I'm finding mercury underneath them, and sometimes mercury underneath them, and then a filling on top of that, and then a crown on top of that. So it's these just like sneaky things like that that we'll discover them. So that's the protocol. We also wear certain barriers, certain face masks when we're doing that part of it as well.